Gonna pull the curtain for privacy. Hi, my name's Josie and I'm gonna be your student nurse today. I'm just gonna gel my hands and put some gloves on. How's your day been so far?
Wonderful.
Good. And from the looks of the physician's orders, it looks like we're gonna do an eye, ear, and neuro assessment today. Does that sound okay?
Yes, it does.
All right. And can you please verify your name and date of birth?
Penny Lindholm, 3/12 of 1970.
And do you have any allergies?
No.
Okay, that looks to all be charted correctly. So what we're going to start with is we're going to start with your eye assessment, and I'm just going to ask you a couple questions regarding your vision. Have you had any eye injuries?
No.
All right. Have you had any history of glaucoma or cataracts?
No.
And have you been experiencing any vision loss or anything?
No.
All right, perfect. So I'm going to start by assessing your peripheral vision, and I'm just going to have you cover one eye. And I just want you to tell me when my finger comes into view, okay?
Okay.
And I'm standing about 60 to 90 centimeters away from the patient. All right, you ready?
Uh-huh.
Okay.
Yep. Yep.
Perfect.
Yep. Yep.
Okay, we're gonna try the other eye now.
Good. 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 Good.
All right, so next we're gonna assess your extraocular movement. So I'm just gonna assess your eyes, make sure that they're aligned and equal in shape, which they are. Your eyebrows and eyelashes are all aligned and equal as well, and they're evenly distributed, so that's good. So next, we're gonna assess your 6 cranial movements. So what I'm gonna do is I'm gonna have you focus on my finger right here, and you're just gonna follow it with your eyes into the 6 different directions, okay?
Okay.
And during this, we're just looking for any wiggling of either or both of your eyes, which I don't see any, so that's good. All right, that was good. Next, we're gonna do a cover and uncover test so I can assess your pupils and just make sure that they constrict and dilate equal to one another, okay? So what I'm gonna have you do is I'm gonna have you cover one eye and uncover it 3 times, okay?
Oh.
I'm just gonna assess. Okay. Perfect. Okay, and then you wanna do the other eye? Perfect. All right, so now we're just gonna look at your eye more in depth. So can I have you pull down your bottom pupil, and I'm just gonna look at your conjunctiva. It's good, light pink in color. You can let them go now. And then I'm just gonna have you close your eyes, and I'm gonna feel for any lumps and bumps. Make sure that there's no edema or any lesions or anything, and make sure your lacrimal ducts and glands aren't inflamed at all, which they don't look to be. Just gonna look at your sclera, which is nice and white, so that's good. And your iris and pupils both look good. Color's blue, so that all looks to be good. So next, I'm just gonna take my pen light and I'm gonna assess your cornea and your lens, okay?
Okay.
So what I'm gonna do is I'm gonna shine my pen light into your eye and make sure that it constricts when the light's over it and dilates when the light's off, okay?
Okay.
All right, so we're gonna start right here. Perfect. We'll try it one more time. Perfect. I'm gonna do this eye. Perfect. Alright, I'm gonna do it one more time, and I'm just gonna look at the other eye to make sure that it's equal with constricting. Good. Perfect. One more time. Perfect. That was good. Alright, so now I'm just going to have you focus on my finger, and your eyes should constrict a little bit and cross over, which they do. And when I remove my finger, I just want you to focus on something on the back of the room, okay?
Okay.
All right, you ready? And then just focus on something back there, and your eyes should dilate a little more and uncross, which they did, so that's perfect. All right, last thing for your eye assessment is I'm just gonna have you read this, okay? Can you tell me what it says?
Today is Wednesday.
Perfect. All right, so now we're gonna move on to your ear assessment, and I'm just gonna ask you a couple questions. Have you had any ear injuries before?
No.
Okay, have you been experiencing any hearing loss?
No.
And do you have any history of sinus infections or anything like that?
No.
Okay. So what I'm gonna do now is I'm just gonna look at both your ears. So is it okay if I touch them?
Yeah.
Okay. So we're just looking to make sure that they're equal in size and shape, and they're aligned, which they both look to be aligned and everything. Now I'm just gonna pull your pin up back, push it forward. I'm gonna pull on your auricle, make sure that's good. Push on your tarsus, which is good. And then I'm just gonna apply some pressure to your mastoid process. Was there any pain with any of that?
No.
Okay. I'm just gonna check the surrounding skin for any lesions. Which I don't see any. So that all looks good. Just gonna look at your other ear. You're gonna do the same thing. We're gonna pull on the pinna, push it forward, pull on the auricle, put a little pressure on your tarsus and your mastoid process. Was there any pain with any of that?
No.
Perfect. So next I'm just gonna take my pen light and I'm gonna look inside your ear and look at your tympanic membrane, okay?
Okay.
Alright, so we're just gonna pull the ear back, down. Alright, I can see your tympanic membrane in there and it's gray and it looks nice and your ear canal is clean, so that's good. So that all checks out. Okay, I'm gonna check the other ear. Make sure that's good. Okay. And that one looks good too, nice and gray. And your ear canal is clean, so we're good there. Alright, next I'm just going to stand about 1 to 2 feet behind you and I'm going to whisper into this ear, I'm going to whisper into your right ear and then your left ear, and I just want you to repeat what I said, okay?
Okay.
Okay, you ready?
Mm-hmm. Today is September 2nd. We are in Platteville.
Perfect. That was excellent. And everything checked out. All seemed to be good with that. So that's all good. Fix your hair. Thank you. You're welcome. So yeah, everything checked out with your ears. And that all looks good. So now we're going to move on to your neuro assessment, okay?
Okay.
So with that, I've been monitoring your facial expressions, your behavior, your posture, and your grooming through all of that so far. And it's all been good. There's been no concerns with any of that. So that's good. And then, yeah, so everything checked out there. So now we are going to assess, oh, and you've been alert to person. You told me your name and date of birth. So can you please tell me where we are?
At your house in Platteville.
Perfect. And what month is it?
September.
Perfect. So you've been alert to, or you're alert to person, time, and place, which is all good. So now we are going to have you, I'm going to repeat 3 numbers to you and I want you to repeat them back to me, okay?
Okay.
4 to 18.
4 to 18.
Can you repeat them backwards?
18, 4 to.
Perfect. Yeah, perfect. Good job. I think for myself. So that was good. I'm going to repeat 3 words to you and then I'm going to ask you to repeat them back to me at the end of the assessment, okay?
Okay.
So I'm going to have you remember them. So the 3 words are couch, cat, and shelf.
Couch, cat, and shelf.
Alright, at the end of the assessment, I'm going to have you repeat them back to me, okay?
Okay.
Okay, so now we are going to assess your cranial nerves, and we're going to start with olfactory, which is your sense of smell. So I'm going to have you close your eyes real quick, and I'm just going to run this under your nose, and I want you to tell me what it is, okay? Take a couple sniffs.
Cinnamon.
Perfect. And we already assessed, you can open your eyes again. We already assessed your optic nerve when we did your eye assessment, and your abducens when we had you do your eye movement and all of that. So that all was good. So now we're going to assess your trigeminal nerve. So I'm going to have you close your eyes and I just want you to tell me where I'm touching you, okay?
On my forehead.
Perfect.
Cheek. Cheek. Chin. Nose.
Perfect. So next what we're going to do is I'm going to have you try your facial. We're going to test your facial nerve. So I just want you to smile. Perfect. Can you frown? Can you puff out your cheeks? And then raise your eyebrows. Awesome. Those were all good as well. And we already tested your acoustic nerve when we had your hearing assessment, so that was good as well. So next we would assess your hypoglossal, or your glossal and your vagus nerve. And for that I would have you stick out your tongue, and I would have my little stick and I'd have you say ah, and I would test your vague reflex for that one, but we won't do that today. And then we are going to assess your accessory nerve. So I'm going to put my hands on your shoulders and I just want you to shrug them up, okay?
Okay.
Perfect, that was awesome. And then we are going to assess your hypoglossal nerve, and for that I just want you to stick your tongue out and move it side to side. Awesome, perfect there. Okay, for the next part of the neuro assessment, I'm going to have you close your eyes and I just want you to tell me where I'm touching you on your body, okay?
Okay.
Alright.
My arm. My arm. My knee. Foot.
Perfect, you can open your eyes back up again. Now what I want you to do is I want you to take each finger and touch it to each, or to your thumbs, okay? So, yep. Perfect, that was all good. Next, can I have you take off your shoe, and we're gonna assess your Bevins, or your Babinski reflex. So what I'm gonna do is I'm just gonna have you lift up this foot a little bit, and I'm just gonna take my pen light and run it all alongside the outside of your foot, and we're just looking to see if you flare your toes out at all, which there seems to be no sign of that, so that's good. That's typically common in babies, and it resolves itself or it goes away as you grow up and everything, so that's good. That all looked good. And next we did your superficial sensation when we touched all of those, so that was good. Your fine motor, so that all checked out. So can you repeat those 3 words to me that I had you remember?
Couch, cat, shelf.
Perfect. And is there anything else I can do for you while I'm here?
Nope.
All
You
right.
did wonderful for me.
Thank you. Then you have a good day.
You too. Thank you.
Thank you.